fighting, you are stressful in these tables, chairs, while you are sitting. So you increase your blood glucose while you are sitting if you are in stress, or you can increase your lipid levels. Also, blood clotting increases, so maybe you heard someone get a stroke because of the high stress, because of seeing a damaging person, or hearing that one of his relatives, her relatives died, and he or she was loving him or her dying person very much, so cannot resist the loss of the loving person. So can get stroke because of the clotting elevation in the vessels. And also goosebumps like this to appear bigger. So what about the parasympathetic nervous system? It is the restoration or recovery after fight or flight. Control of the sympathetic nervous system. So sleep necessary for daily sympathetic regulation, and this parasympathetic system is active during sleep. So if you don't have enough sleep, you cannot get rest. For example, today, for example, you work so hard and you get exhausted because of working too much. But if you take a good sleep, then tomorrow morning you can wake up very well. Because in the sleep, restoration happens, recovery happens, and growth, development happens. So for the child and children, sleeping is very important for growing. And also for resting, calming, relaxation, proper digestion, food tolerance, and microbial regulation, microbiota regulation, parasympathetic nervous system activity is very important. So if you increase your parasympathetic nervous system activity, then you can do it well. There are lots of vicious cycles in autonomic nervous system. One of them is the sleep. For example, if you are stressed, you cannot sleep properly. So in the morning, you are more stressed because of sleep loss. And after that, again, let's skip the other slide. Again, after next evening, because of the high stress, again sleep loss. Because of the sleep loss, you are got more stress. So this is a vicious cycle. So you should cut this vicious cycle for healing. Sympathetic tone must be reduced to fall asleep. So why we are yawning, for example, before sleep, when we feel sleepy, we are doing yawning. So what is the aim for that? Have you ever thought about that? Why we are yawning or stretching like that, for example?
What somebody say it's to increase the amount of oxygen in the body.
Yes, but it's the secondary point actually, because in the morning also the same oxygen level. In the morning, in the afternoon, same oxygen level. But when we feel sleepy, we start yawning. Why?
Is it to increase the volume of the lung?
Yes. For what?
To activate the parasympathetic.
Yes. For better sleeping. For easier going down to the sleep. So we are yawning for that. Increasing the lung capacity, increasing the stretches in the lung. So we can increase the parasympathetic activity. We can fall down to sleep easier. That's the aim actually, but we do it unconsciously. But the aim behind this increasing the vagal activity, vagus nerve activity or parasympathetic nervous system. So if you don't have enough sleep, quality is less, then sympathetic activity increases. And sleep decreases as sympathetic activity increases with aging. We will also come to this later, I think, in our slides. So, in insomnia or persistent sleep disruptions, increase the risk of hypertension. Why? Because if there is not enough sleep, sympathetic activity increases. If sympathetic activity increases, your blood pressure increases. If your blood pressure increases, then your atherosclerosis increases, blah, blah, blah. So there is a positive feedback for the disease like that. If you cannot cut in somewhere else the cycle, then you cannot heal the patient actually. So the patient can feel pain in his or her back, but if you don't concentrate on her sleep, his sleep or stress level, for example, you cannot cure totally the patient.